Hello, welcome to Acharya Nidana Academy. In the past several videos, where we are discussing about the uh, method of case taking, how we are going to interact with the patient, how we are going to elicit the chief complaints of the patient, what are the significance of noting the symptoms in a chronological order, and how we are going to take the history of presenting illness. After that, we have discussed about the previous history. What are the informations? What are the document that has to be entered in the history of past illness? We have discussed so far. In this particular video, we are going to discuss the treatment history. So, what kind of the treatment that is being adopted by the person who is visiting the hospital or your OPD? We are going to uh, document in this particular section of case taking. It may be either of allopathic treatment or it may be either of Ayurveda treatment. When you think about the treatment history, it is nothing but a case record which gives the details about the names of the medicine used, dosage of the medicine, time duration of the medicine intake that will be recorded here. If the person is hospitalized, what kind of treatment is being given, that has to be recorded here. And why we need to know about these different medicines? So we are in a better position to identify what may be the possible diagnosis the person is suffering from and what might be the probable complication the person may come across that can be noted here. We are going to ask about whether he is receiving any kind of the Ayurveda treatment or allopathic treatment they are receiving, that has to be recorded here. When you think about the allopathic treatment as such, so there are certain medicines, whereas these are the simple different names of the medicines for the namesake. When you look into that, the name of the medicines go endless. So these has to be recorded if it is possible, if they are knowing regarding the dosage, since how many days they are going to take this particular treatment, that has to be recorded here. For example, Eptoin. The person is who is taking Eptoin, that is usually around 100 mg of tablet that is specifically used in the treatment of epilepsy. Aldroxin, 100 mcg tablet, which is usually given in the treatment of hypothyroidism. Metformin, 500 mg, Dianyl, 5 mg, etc., used in the treatment of diabetes mellitus. Enalapril, 2.5 mg, amlodipine, 5 mg, etc., are used in the treatment of hypertension. Ecosprin, 75 mg or 150 mg, used as a blood thinner in the patients who are suffering from ischemic heart disease or myocardial infarction. Paracetamol, 500 mg, used as antipyretic drug. Azithromycin, 500 mg, or amoxicillin, 500 mg, etc., are used as antibiotics. So, when they are taking these medicines, we are in a better position to say or predict they may be what kind of diseases they are suffering from. As far as Ayurveda treatment is concerned, whether person has received Vamana or Virechana or Basti or Rakta Mokshana or Nasya, they are being done or not. When you go to the Ayurveda hospital, more than 65 different modalities of Panchakarma treatment are being practiced. So, if the person has received Vamana, probably they may be suffering from either kapha dominant disease. If the person is having the Rakta Mokshana, they may be suffering from, they say that the Rakta dominant disease, or that where abnormal or dushita Rakta, vitiated Rakta is being present. Virechana, practiced when the person is suffering from Pitta dominant disease. Basti, that is being given when the person is suffering from Vata dominant disease. And Nasya, when the person is suffering from the disease related to ENT section or eye section. So like that. So this may be giving a rough indication why they are being given this kind of treatment as such. Kamadugarasa, specifically given in the person suffering from Amla Pitta, or who may be suffering from either Pitta dominant disease. Kaishora Gugulu, used in the treatment who is suffering from either Vata Rakta or condition where Rakta affliction is being seen. Arogya Vardhina Rasa, specifically given in the treatment of Jara or Kushtha. Kanchanara Gugulu, when the person is suffering from Galaganda or the neck swelling. Navaka Gugulu, used in the person suffering from Sthaulya or obesity. Simhanada Gugulu, who are suffering from Amavata condition as such. Vishathindukavati, where that is specifically given in the patient who is suffering from Ridhrasi as such. After giving this, whether the person is doing the proper Pathya or Apathya also has to be noted. If they are doing it, definitely, and if the person is actually responding, then the person may have the elimination in the symptoms itself. If they are not, there may be a possibility of either the disease may not subside, it may remain as it is, or the person may have aggravation of the symptoms. To summarize, treatment history should help in the documentation of medicines consumed by the patient. It may be related to presenting complaint or may be related to the other complaints other than presenting complaint. What kind of allopathic medicines are being used? That has to be documented. And what kind of Ayurveda treatment is being followed? That has to be documented. Whether Shodhana or Shamana line of treatment is being followed, or otherwise Pathya or Apathya is being followed or not, that has to be noted. Here, one example let me give. If this is the further, the inquiry, if they are knowing, or inquiry related to the case discharge forms as such. For example, if the person is being, Basti is being given, what kind of Basti is being practiced? Whether it is Karma Basti, Kala Basti or Yoga Basti, what kind of the Basti specific as far as the ingredients are concerned, whether Vaitarana Basti is being given, or Madhutelaka Basti is being given, or Dashamula Niroha Basti is being given, or Mustadin Niroha Basti is being given, or Rajayapana Basti is being given. So like that, that has to be documented in your case history. And if the person suffering from Pitta dominant disease, usually Kamaduga Rasa is being preferred. Dear ANA members, that's all for today's video. What are the major key takeaways from this video? Mention in the comment box below. And what is the one video that you would like to hear in this channel? Mention in the comment box below. And if you are liking this particular video, then put a thumbs up and spread this particular video to maximum number of true Ayurveda learners, so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.